I'm bleeding. It hurts so bad. Help me. Before treating the patient, make sure to inform the patient of the severity of the injury. If the laceration is on the face, make sure to give them the option of seeing a professional due to the risk of scarring. First, you need to assess the risk of infection by looking at the type of trauma, where it occurred, and if antibiotics may be needed. Secondly, foreign bodies must be removed safely. Next, make sure the structures are intact, such as nerves, muscles, and tendons, through a functional exam. Lastly, verify that the injury occurred less than 12 hours prior or 24 hours prior for lacerations that occur on the face before closing the wound. When closing the wound, bleeding must be controlled by pressure and ice application if needed. Next, make sure the wound is closed and that there is no excess skin tension before closing the wound.
The first step is to apply gloves.
Good job.
The second step is to put a gauze pad over the wound to stop the bleeding. Put mild pressure. The next step is to take an alcohol prep pad to wipe away the blood. The next step is to apply the adhesive on each side of the wound. This is used to help the Steri strips stick. Next, pinch both sides of the wound together and apply the Steri strips 2 to 5 millimeters apart until the wound is closed. Once they are applied, instruct the patient to leave them on 2 to 5 days.
First, I'm going to apply the gauze pad to the injury to stop the bleeding before applying the skin adhesive. Now the bleeding has stopped, so we're going to apply the skin adhesive over the middle and 5 to 10 millimeters on each side. We're going to do 2 to 3 layers every 5 to 10 seconds.
For hair approximation, it can be used with simple lacerations when the hair is at least 3 centimeters long. Use 4 or 5 strands of hair on both sides of the wound. Then twist the sides together while pulling the skin together on each side of the wound. Lastly, apply the glue to the knot and then leave it for 3 days before removing.